SB 233. The clerk will read.
Senate Bill 233 by Senator Skinner and others, an act relating to healing arts and declaring the urgency thereof to take effect immediately.
Majority Leader Aguiar-Curry, you are recognized.
Thank you, Mr. Speaker and members. SB 233 temporarily allows Arizona doctors to provide abortion care to Arizona patients in California. On June 6, 2024, Arizonians will face a total abortion ban because courts upheld a law that was enacted in 1864. Arizona has repealed the 1864 law, but the repeal doesn't become effective until late October or early November at the earliest. In the meantime, patients will be left without reproductive health care, and doctors providing care in Arizona will face 2 to 5 year state prison sentences. Lack of access to safe, effective doctor-provided abortion means extremely dangerous conditions for pregnant individuals. Studies say that an abortion ban within the United States would lead to a 21% increase in pregnancy-related deaths and a 33% increase in pregnancy-related deaths among Black women. This bill will help Arizona's patients access care by allowing Arizona doctors to treat patients from Arizona, but in California. Under this bill, an Arizona doctor would need to meet specific criteria to practice in California. They must hold and verify that they've had a medical license in good standing from Arizona and have performed at least one abortion under their Arizona license within the last 2 years. Pending the ballot measure coming this fall, California should allow Arizona patients to access care with standards that respect the rights of patients and the ability of doctors to serve their patients without the threat of government intervention or criminal penalty. I respectfully ask for your aye vote.
Thank you, Assembly Member Aguiar-Curry. Dr. Baines, you are recognized.
I want to thank the authors, the governor, and the Women's Caucus for coming together to bring this life-saving bill forward today. Arizona's inhumane 1864 abortion ban, which has no exceptions for rape or incest, is a prime example of how striking down Roe and letting each state decide if women should have reproductive rights or not is categorically insane. We often hear our colleagues on the other side of the aisle claim it is moderate to leave abortion up to states. I am a woman. I have brown skin. I hope you wouldn't call it moderate to let each state decide if I should have the right to vote. So why is it moderate to let them take away my right to get health care? Women and doctors are literally fleeing states like Arizona just so they can exercise their basic rights. As a physician, I shouldn't be criminalized for delivering medically appropriate reproductive care. And as a woman, I shouldn't have to drive across state lines to receive that care. Despite being in the minority in Congress, Democrats are the ones getting things done in our nation's capital. In Arizona, Democrats are also in the minority, but they led to repeal this ban. And the Democratic governor signed it just last week. Unfortunately, because the Republican majority voted to keep the ban in place, the repeal won't take effect until nearly Election Day in November. I hope every woman, every doctor, every parent, every brother remembers who stood up for their rights on Election Day. The reason this California bill is even more necessary is because the Republican majority voted no. They were given a chance to fight for women and they said no. Thank you again for bringing this bill forward. I urge us all to stand with women today and vote yes.
Seeing and hearing no further debate, Madam Aguiar-Curry, would you like to? Close.
I respectfully ask for your aye vote, Mr. Speaker, and I request immediate transmittal to the Senate.
Thank you, Assembly Member. Clerk will open the roll. All those vote who desire to vote. All those vote who desire to vote. All those vote who desire to vote. Clerk will close the roll and tally the votes. Ayes 55, noes 13 on the urgency. Ayes 55, no